This is Jessica Carberry again, gonna do an assessment on Jenny here on her abdomen. Oh, sorry for my dog, she's making noises. Alright, so before any assessment we start out with asking questions related to the body system. So first, Jenny, are you having any changes in your appetite?
No.
Okay. Any recent changes in weight, such as weight loss or weight gain?
No.
Okay. Are you having any difficulty in swallowing or any abdominal pain whatsoever?
No.
Okay. Any nausea, vomiting?
No.
All right. How about your bowel movements? How often do you go a day?
Once a day.
Okay. And tell me about them. Like, can you describe the stool to me? Like the color, color consistency. I know it's funny. I have to ask everybody.
Solid brown.
Is it hard to pass or
Normal.
easy?
No. Easy.
Okay. So no constipation, any diarrhea?
No.
Okay. Do you use laxatives?
No.
All right. Next is the history. Do you have a history of GI issues such as ulcers, gallbladder issues, liver issues, appendicitis?
No.
Okay. Any surgery to the abdomen?
No.
And have you ever had an x-ray study?
No.
Okay. All right. So, and then I need to assess your nutrition. So if you can tell me either today or yesterday what you ate in the day, during the day, starting with the first thing you ate.
This morning I had a bowl of cereal and a banana. Then for lunch I had a salad.
Okay.
And then dinner I had chicken cutlets, whole wheat noodles, and green beans.
Okay. That's the best cook made for you, right?
Yeah.
Okay.
Mm-hmm.
And do you have access to fresh local food,
Yes.
such as like produce?
Mm-hmm.
Okay. All right. So I'm gonna start the exam now. So I'm gonna start with the inspection. So I'm gonna look at the abdomen. I'm looking at her stomach front on, and then also on the side I can look and see the contour of her stomach, which is flat. I'm gonna ask her to take a nice deep breath. Okay, good. And it's symmetrical with movement. I'm looking at her umbilicus, which is midline in the stomach, which is normal. And I'm also looking at her skin. She has no incisions, no scars, no stretch marks, which is good. And then I'm going to just pinch her skin a little bit. I'm just checking skin turgor. It checks for hydration, which is good. There was no tenting. Now I'm going to listen to your bowel sounds before palpation or percussion because that can affect how accurate they are. So you start in the right lower quadrant and then you work your way around. So I cleaned this beforehand. The bowel sounds are neither hypo nor hyperactive. They're regular, they're occurring every few seconds. A gurgling sound, which is normal. Okay. All right. And when was your last bowel movement?
About 2 hours ago.
Okay. Good, so you went today. All right, so now the next part of the exam is percussion. So I'm gonna like tap on your stomach.
Okay.
It doesn't hurt or anything, but just try to relax and stay calm.
Okay.
So you just start in the right lower quadrant and you just tap in a clockwise motion. And you hear tympani, which is the normal sound that you hear over the abdominal cavity. Okay. Now I'm going to attempt to percuss the liver and try to measure it. So I have a ruler here, and I have to have my little cheat sheet here just because it helps. So I'm going to start, I'm just feeling in between your ribs here, okay? Because they have a different kind of sound. They have hyperresonance when you're percussing. And sometimes you can hear the difference which you can hear there. And you can mark the border of the liver. I'd say right about here is where it changes. So I'm right in the 11th intercostal space here.
So that's where it starts?
Yeah, that's the lower border of the liver. Okay. So your liver kind of, when you take a deep breath, the border edge of your liver drops down. So if you have an enlargement of the liver, it could be, you can hear it like further down as you percuss. So I'm just going to lay this here and just see. It has a dullness to it. And take a deep breath. Take another deep breath for me. Yeah, that's still. So I would say to right about here. So we're looking at about 5 centimeters, which a normal adult is. You're more petite, so a normal adult is about 6 to 20 centimeters. So the next organ, which normally you can't palpate this or really percuss it, but you can percuss for dullness of the spleen, which is mid-axillary line here, right in the middle of the axillary and down. So again, I'm going to find my intercostal spaces here and just see if I can hear the difference. I'm not really hearing it here, which is normal. I'm also going to palpate while I'm here. I don't feel anything here. So, which is good because the spleen normally you can't palpate it. Okay. I'm also gonna, since I was in that area, I am gonna palpate the liver, see if I can palpate the liver here. You can come in at an angle like that's under the rib cage. It's kind of called the hook method. So go ahead and take a deep breath. And I'm able to feel it. It's firm. There's no tenderness with that, right?
No.
Okay. Yep. Okay. Feels good. Now I'm going to have you sit up, okay? If you need a hand. I'm just going to attempt to percuss her kidneys. It's kind of reminds me of like the kidney punch. I don't know if you ever heard of boxing, but if you have any tenderness with this, just let me know. Have any tenderness?
No.
Okay. Any tenderness?
No.
Okay. At the costa vertebral angle here, you can attempt to palpate the right kidney, the bottom of the right kidney. Sorry if you're too much. Go ahead and take a deep breath. One more. Okay. All right, you can lay back down. Almost done. Now I'm just going to go in a circular motion around your stomach. Let me know if you're having any tenderness with this, okay? I'm going to go lightly first. You always start with light palpation first. Any pain?
No.
Okay. A little deeper now. Any tenderness or pain?
No.
Okay. That's good. So I'm all done, my exam. Do you have any questions?
No.
Okay. Thank you.